Excuse me.
What?
You work in 3 East, don't you?
Yes. I work in general surgery. I know Mr. Carl. He works at my brother's company. I was just wondering about his condition.
The event you have just witnessed is an all too common case of breaching patient confidentiality. The nurse from 3 East is reading a patient's record for personal reasons, not to help in the patient's care.
When people make a decision to come to the healthcare system for help, they hope that their right of privacy, a basic right in our society, will be respected. Anyone who works in healthcare must safeguard that privacy. It is your ethical and legal obligation. Without a promise of confidentiality, patients often hesitate to even seek care, much less divulge the highly sensitive information needed for optimal care. Healthcare workers should only have access to information they need to provide optimal care to that patient.
This presentation will discuss the issue of patient confidentiality. You will learn to identify potential risk to patient privacy, learn basic principles for protecting that privacy, and learn what to do for a patient whose privacy is at risk.
Patient confidentiality is a conscious effort by all healthcare workers to keep private any protected health information, or PHI, revealed by the patient in the process of healthcare. Information such as personal identity, physical or mental health condition, type of healthcare provided, and payment of that care must be kept confidential. People with physical, psychological, or emotional healthcare problems are cared for in hospitals, ambulatory care, long-term care, home health care, rehabilitation centers, and hospice care. In each setting, every healthcare worker is obligated to protect the privacy of the patient. Anyone who cares for and consults with patients at or for your organization, who hears conversations about patients, or who has access to patient information can potentially violate patient confidentiality.
As a healthcare worker, you're responsible for monitoring your own behavior and the behavior of others. Let's take a look at some examples of violations of patient confidentiality.
So, Mr. Calpello, we will complete your testing tomorrow morning to check on the effect of your cancer to the other systems of your body. That will help us decide on the course of your treatment. Do you have any questions?
Well, doctor, just let me say this. My wife and I have decided that if the cancer is extensive, we don't want any heroics.
I understand. These are very difficult decisions to make. Let's talk more about it tomorrow after we get the test results.
I'll be back soon, honey. I want you to rest for a short while. Doctor, tell me what you really think with the results we have so far.
As we discussed, the cancer has already spread. We are now trying to find out how far. It doesn't look good. I don't know how long exactly. It could be a couple of months, or it could be a year. We'll know more after tomorrow's test.
Mr. Carpello, in room 562, does he really have terminal cancer?
Oh,
He's my neighbor. I had no idea that he was so sick. He's head of our neighborhood watch committee. I wonder, gosh, I better tell the other members of the committee.
Dad, that doctor who just left your room, she was talking about your roommate, and she said he was really sick. Do you remember what his name was?
Yeah, his name is Mr. Capello. What do you want to know his name for?
Mr. Carpello, I think he works for my husband's company. I think he's a manager there, and they're like consolidating management positions right now, so I better tell my husband.
Discussing confidential information about patients in the hallway or any public place where others can overhear your conversation. The volunteer, the roommate's daughter, and the roommate all violated patient confidentiality after hearing confidential information.
Oh, excuse me. The patient in that room, Mr. Harvey Martin, well, he's a friend of mine, and I'm kind of concerned about him. How's he doing? I mean, I heard he had some kind of weird pneumonia or something. How is he?
Well, he really doesn't look too good. We're to be extra careful with this room. I heard it might be something like AIDS.
No patient information can be shared by any healthcare worker without prior written authorization from the patient. Strangers should never be given information.
So, Jan, darling, I heard this rumor that the woman who was running for the state senate, she was admitted to your psych ward a while back. So, is this the truth? Come on, what's the scoop?
Well, this is not for public consumption, but she was admitted and treated for serious depression. As a matter of fact, she was suicidal.
Patient information cannot be divulged by a healthcare worker regardless of the setting, formal or informal, professional or social, without the patient's prior written permission.
Hey, you guys, did you hear that Harvey's been admitted into the hospital?
Really? I wonder what for. He seemed to be losing some weight recently. I hope it's nothing too serious.
I bet it is.
I think he's in one of our facilities. It seems like I saw his name on an x-ray file this morning.
Carol, pull up his name on the computer. Let's see if he's all right.
I'm pulling it up now, and here it is. Admitted with the diagnosis of pneumonia, secondary to HIV infection.
I knew it.
Healthcare information in any form, computerized or in any other medium, is confidential and should not be accessed unless specifically needed to deliver care to the patient.
Good afternoon, ambulatory care.
Hello, Sarah.
This is Sarah. Well, how can I help you?
This is Pam Good. I'm calling from healthcare insurance. Well, we have a situation with two patients of yours.
Yes?
To resolve matters, I will need some information from you. I need a diagnosis
I don't know if...
for Harold Soames and Megan Carter for reimbursement purposes.
Well, could you wait just a minute? I mean, I have the records here, but...
It's
yeah,
really
I need to look.
simple. I just need...
Please hold a moment. Clinical depression, hepatitis B. Well, yeah, I have them. I'm just not so...
Mail them.
Well, I don't know if
Actually, just fax the diagnosis.
Okay, just give me your fax number again, please.
Requests for patient information by insurers, group health plans, etc., must be dealt with according to the guidelines established by your facility. Information given over the phone is subject to non-secure phone lines, and you may not be able to verify the caller's identity. Also, controlling confidentiality with a fax is difficult, since the requester may not be legitimate, and the receiving machine may not be secured. Always follow your facility's policy when it comes to faxing medical records.
excuse me. I'll be back in a moment.
The mother of the patient is reading confidential information about her adult daughter, most likely without prior written authorization from the daughter.
Hello, Dr. Gowan's office. How may I help you?
This is Attorney Martha Soren's office. We are requesting copies of medical records on a patient, Merle Simmons.
What is it that you need exactly?
Well, the entire record is needed, naturally.
Okay. Well, then if I can just get your name and address, then I'll try to get that out to you by the end of the week. Is that okay?
Records may only be sent to a law office when they have been subpoenaed or upon written authorization from the patient. Otherwise, the patient and your organization may be put at legal risk.
Patients have a fundamental right to privacy that is governed by law. The Centers for Medicare and Medicaid Services, or CMS, the Health Insurance Portability and Accountability Act, or HIPAA, and the Standards for Privacy of Individually Identifiable Health Information protect the confidentiality of patient information.
Patients must be given written notice of their rights to privacy of health information, as well as how that information will be used and disclosed. Patients have the right to access their records in a reasonable time frame, review them for accuracy, and have their comments included for the record. They have the right to request restrictions on disclosure of certain information, and to file a grievance if they believe these rights have been violated. You must protect and promote these rights at all times. You should share protected information with others in the healthcare system on a need-to-know basis only. Provide only the minimum necessary information. Remove identifying information whenever possible. Certain special situations allow for disclosure without prior written permission. Some examples are certain medical emergencies, reporting abuse, neglect, or domestic abuse, reporting certain information to public health agencies, verifying medical claims filed under Medicare and other government programs, and judicial and administrative activities. Follow your facility's guidelines for providing information under these special circumstances. Several factors in today's society make it difficult to maintain confidentiality. Often, a great number of people from different disciplines and departments care for the same patient. Computerized records give the healthcare team instant access to information needed to care for patients. But this same technology also gives access to people who may wish to breach security of confidential information. Many people besides caregivers gain access to patient information. Group health plans, insurers, and others often demand detailed health information. This information is often requested by phone, fax, or email. Privacy and security also limit the use and disclosure of PHI to the minimum necessary, the least amount of information needed to get the job done, unless it's used for treatment.
These days, patient confidentiality can be difficult to maintain. That's why your facility has detailed policies to protect patient information. Patients rely on you to honor your promise to protect their privacy. Failure to honor this promise can produce dire consequences, as seen in the following examples.
Mr. Carl. Back on the job, he hears false rumors that he is having marital difficulties, since his hospital record stated he was experiencing stress in his marriage prior to his heart attack. Mr. Carpello lived for another 2 years. He lost his job and his community activities due to the violation of confidentiality by both his roommate's daughter and his neighbor, the volunteer. Harvey Martin lost his job when employers learned of his diagnosis, first through rumor, then by looking up his diagnosis on the computerized patient information system. Young woman politician harassed by the media when someone leaked her recent treatment at a psychiatric unit for suicidal tendencies. Patient diagnosis sent to insurance company. Patient with a diagnosis of HIV lost insurance coverage. The second fax, due to a misdial, was accidentally sent to a local car dealership. Maternity patient estranged from her family when the patient's mother learned from reading the medical record that her daughter had an abortion in the recent past. Merrill Simmons, an attorney, lost a custody battle for her child due to a history of psychiatric therapy 10 years earlier related to her mother's traumatic death. As a healthcare worker, every day you see, hear, and handle many pieces of confidential information. We become so used to being around this type of information, we tend to forget how important it is to keep it private.
How do we protect our patients' confidentiality? What should you do if you see or hear about a situation where a patient's confidentiality has been violated? Let's take another look at the scenes we saw earlier and see how we might have handled those situations differently.
You know we have an obligation to protect the privacy of our patients. The information you're reading is confidential.
You're right. I'm sorry. I was worried. I'll wait and speak with Mr. Carl when he gets better.
Healthcare workers should be privy to information as needed to provide optimal care for that patient. You are obligated to protect the privacy of a patient when you see a breach occurring. A breach can mean hefty fines and up to 10 years in prison.
Whoa, Mr. Walters, slow down. I can understand your concern, but we also both know that patient information is confidential, so I'm not at liberty to discuss it with you. I think maybe the best thing for you to do would be to take it up with Mrs. Carpello personally and have her decide how much she and her husband want the public to know.
Hello, Mrs. Carpello.
Oh, hello, Tom.
I'm so sorry to see your husband's in here.
Thanks.
Excuse me, Doctor. I just wanted to let you know that your conversation with Mrs. Carpello in the hall was actually overheard by a friend of the family, actually a volunteer here. Naturally, he was concerned and approached me, and I had to remind him of our obligation to patient confidentiality. I told him that the best thing to do would be to speak with Mrs. Carpello directly.
Confidential information should not be discussed in public places. Confidential information should be shared with members of the healthcare team on a need-to-know basis only. Direct caregivers need full access to PHI to provide good care. Volunteers, as healthcare workers, are also obligated to maintain patient confidentiality.
Patient information is confidential, and I can't discuss it. Why don't you speak to the nurses at the nursing station?
Support staff are obligated to protect the privacy of patients. Information should not be given to anyone without prior written authorization of the patient.
Look, Jeannie, that kind of information is confidential. I can't talk about it even if I wanted to. It's unethical.
It is common for healthcare workers to be asked about confidential information in social settings or in an informal atmosphere. Healthcare workers are under the same obligation to protect patient confidentiality in an unofficial capacity as in an official capacity. The damage done to patient privacy in social settings has been great and should be avoided.
You guys know I can't do that. That information is confidential. I need Harvey's permission before I can look at his record.
Computerized records provide instant access to information necessary to give patients optimal care. Computerization has also helped to reduce healthcare costs. But this technology does pose risk. The information is also potentially accessible to a large group of people who may not have the patient's best interests in mind. Remember, a breach can mean hefty fines and up to 10 years in prison. Facilities develop strict access systems to help protect the patient's privacy, and they hold healthcare workers responsible for protecting patients and not accessing information for personal interest.
Well, yes. Well, thank you for your call. I'd love to get you that information, but I need to have someone call you back. I'll just need your name and number. Yes, thank you.
Requests for patient information by insurers and other payers have become a major issue in maintaining patient confidentiality. HIPAA requires agreements or contracts between your agency and all business associates who share PHI, like claims processing, billing, and transcription services, to make sure they comply with HIPAA requirements. This is termed a business associate contract in the privacy rule and a chain of trust partner agreement in the security rule. Remember to obtain the patient's written authorization and provide only the minimum necessary information. In certain cases, some patients do not wish to sign a release for all records and may request that certain records not be released. Follow your facility's policy in this case. When it comes to faxing patient information, always follow your facility's policy. Usually, a special form is required stipulating that this faxed information cannot be divulged any further. You must verify the legitimacy of the requester.
Hello. Are you the grandmother of this new baby?
Yes, I am.
Well, congratulations. Look, I'm sorry, but this record that you're holding, it's confidential. You need the permission of the patient to read it. I'm sure if you talk with the nurses, they'll give you all the information you need about your daughter. Why don't I just take this to the nurses' station, okay? The mother of this patient was beginning to look through this record, so I suggested they just come over and talk with you about it.
Family members are not always privy to patient information. Records are to be kept in a secured place and should be returned to that area when found elsewhere. Breaches of confidentiality should be reported to someone who can actively advocate for the patient, such as a nurse on that unit or the designated privacy officer.
And are these records under subpoena?
Yes, they certainly are.
Okay, well, Miss Gurko will be in contact with you then. She handles all records under subpoena, so if I can just get your name and number, I'll have her get in touch with you.
When a record is subpoenaed, you must respond. Your facility has a system for handling a subpoena so that the legal system is satisfied and the patient's interest is looked after.
Your employer has developed guidelines to help you protect patient confidentiality, including a method to keep all records secure, whether paper or electronic, guidelines for proper use and disclosure of patient information both within and outside your facility, policies for providing information to family and friends, and a system to inform patients of their rights to privacy of health information.
Medical information that is either written down or not can only be released with a patient's prior written authorization. In the case of a minor, release of information must include written authorization from the parent or guardian. Records are to be kept in a secured location. Computerized patient information must be kept confidential, just like any other medical record. Healthcare workers should be privy to only that information needed to provide optimal patient care. Closely follow your facility's policies regarding release of records to insurers and other payers. When the court has subpoenaed a record, follow the established guidelines of your facility to protect the interests of the patient. Faxing of medical information should only be done within the guidelines specified by your facility. Basically, you must be able to verify that the fax was received by the proper recipient.
There are special instances when information can be disclosed without a patient's prior written consent. In these situations, prior to disclosure, please read and closely follow the guidelines established by your facility. Always remember that as healthcare workers, we are not just responsible for meeting the physical, psychological, and emotional needs of our patients. Protecting confidentiality is just as important to the overall well-being of each patient.